welcome back to Main Street Living. Danielle, Tom, healthcare is a very important and very expensive part of our lives. The US spends more than $4 trillion a year on healthcare, yet chronic illnesses are still on the rise.
Yes, we have Dr. John Mastrototaro with Movano Health here. He's trying to reverse that trend by giving us more information about our own health. Welcome to the show, Doctor. Thanks so much for making the time for us.
Thank you very much for having me.
So, as Cheryl just mentioned, America spends a lot on healthcare, but it's still one of the sickest countries in a lot of ways. How does that add up?
Yeah, well, you're absolutely right. We actually spend twice as much on healthcare than other developed countries, and yet our rates of chronic conditions like diabetes and high blood pressure are higher than them, and in fact, our life expectancy is lower. So there's many reasons for this. I'm going to touch on three this morning right now. So number one, it's our diet. We eat lots of unhealthy food that's not so great for you, and we consume it in large quantities. And what exacerbates this even more is that unhealthy foods are more accessible, they're more affordable, and well, they taste really good as well. And so that is a big problem in general that we have to really look at our diets. And over the last several decades, the sizes of meal portions have increased as well. So it's a really significant problem. The second is related to routine doctor office visits. So we have less of those than other developed countries. A lot of people don't see their doctor periodically. And that's really important because chronic conditions like diabetes or hypertension don't develop overnight. They may take many, many years to get the point of showing up. And so if you have a routine doctor office visit, we can detect some of these conditions earlier in their infancy and be able to better manage them and treat them and even reverse them if they're handled appropriately. And so that's something that we've got to look at. And then the third is we've got incredibly smart scientists and developers of technologies that help cure problems for people who are suffering from various chronic conditions, but often these therapies are really expensive and they cost a lot. So when you think about a costly intervention and a lot of people who have these problems, it results in significant healthcare costs. And so as a country, we need to start to look more at preventative measures and what we can do to try to avoid this situation from happening.
Doctor, how can telehealth and some new innovations help reduce the costs and improve healthcare and attack those three items that you mentioned are the cause of being unhealthy?
Well, first off, telehealth offers two really important options: convenience and access. So, in terms of convenience, when someone has a typical office visit, they may have to take time off from work. They've got to drive somewhere to do it, park, go through the visit, come back, and you lose time. And so that's a challenge for people. And some people don't even have the means of transportation to get to the doctor's office. So that's important. The second is related to access. Some people live in rural communities or remotely, and they simply don't have healthcare professionals nearby, or even in larger cities. Often there are portions of the area where people don't have access to good care. So telehealth can bridge those gaps and help provide care to people when they need it. And there have been some estimates that have suggested that telehealth can reduce our expenditures by $6 billion annually, just as it relates to the care costs. And that's the tip of the iceberg when you think about identifying certain chronic conditions and treating them earlier to avoid the even more exorbitant healthcare costs with it. So it's a real advantage. Now, at Movano, we're also taking a tack to try to help the healthcare of the nation. So we're developing a medical grade wearable device in the form of a ring. I've got one on each finger. We're evaluating the ring technology right now. And what we're trying to do is help inform and empower people with knowledge so that they can have a better understanding of their health. We want to help describe how their activities of daily living can affect their health metrics over time and empower them with that knowledge so that they can make more conscious choices about how to lead their life. And lastly, what's really important about a wearable tech at home is by monitoring people's health metrics over time continuously, we can identify if their condition starts to waver from normal control, bring that to their attention so that they can seek medical advice more rapidly before the situation gets out of control and is more serious.
Well, I mean, it's incredible that you guys are working on this, obviously, and we know there's stuff that's in the market already. What should viewers consider when they're choosing wearable tech, especially for healthcare reasons? Like we have smart rings and watches.
Yes, we do. And, I applaud all the work that's been done to date with wearables. If they've done nothing more than get people to take a few extra 100 steps per day or be more conscious of their sleep, that's really important. But now we're trying to take the technology to the next level and really integrate it into health. So, first and foremost, when choosing a wearable, the person should choose a wearable that they will actually wear. It's really important that you wear the device to benefit from it. In our case, we've developed this ring to be form fitting. It's actually got a little break in the ring, and so it has a little flex so it can expand over the knuckle and then fit snugly on the finger. And we want to make it look aesthetically pleasing so that people would enjoy wearing the ring. That's very important to us. And then secondly, consumers should think about what their goals are related to using a wearable product. Are they using it to just help with activity and sleep? And if so, there's many solutions for that. But if you're, say, trying to manage a chronic condition, or you have older family members or mom or dad who had high blood pressure or diabetes, and you want to try to do more to potentially avoid ever getting it yourself, then you want to probably go with a device like ours that's really focused on health and is presenting the data in such a way that makes it more understandable to you so that you can make changes in the way you lead your life to be able to benefit from the technology.
Doctor, how does the Evie Smart Ring work, and how is it different than other items like this on the market right now?
Yeah, well, first off, it's similar to many of the other devices on the market in that it has embedded sensors within the ring that are monitoring your heart rate variability, which is an indication of your overall general health, your oxygen levels, breathing rate, temperature, your sleep and sleep stages, activity and calories burned and steps, all of those aspects. And then even your mood. There's relationships between the mind and body, and we want to understand how you're feeling. Often people who feel good are healthier. And so we track that. And then for women specifically, because our first product we'll talk later is focused on women, we will track your menstrual cycle and help you understand what's going on with your health through the various times of the month. And then
That is what I was going to ask, is why did you decide to launch a smart ring that is specifically for women?
Well, we decided to launch a product for women for a number of reasons. First and foremost, when we looked at the wearables on the market today, we noticed that many of them were kind of bulky and thick to be worn on the body and not ideally suited to the female frame. Secondly, from a healthcare perspective, often women's needs have been a little bit underserved in healthcare. Women present symptoms often to doctors, and they're sometimes misdiagnosed or even dismissed in healthcare. And so that's a little bit ironic because women are often the CEOs of healthcare for families, and they influence 86% of the spending in families for healthcare. And women's bodies go through a lot of changes through childbearing years and then into menopause. In fact, surveys have said 92% of women feel unprepared for menopause and what's going to happen. And so we thought it was high time to develop a solution that is geared specifically for women and can help them with their health.
Doctor, how can they
Always emergencies.
He's a doctor. That phone's going to ring. Doctors, we have taken a large step in the last 30 years from mood rings to your ring. How can viewers get more information?
So viewers can get more information about our ring, which we're launching this summer at eviering.com. And there's a lot of future innovations as part of this technology. We hope in the future to also measure blood pressure and glucose. And we are a medical device. We have clinical trials that we're conducting through the FDA process to demonstrate the accuracy and validity of the data that we're providing so you can trust the information from this product. And we're really looking forward to the future and being able to get out there and help people as they go on their life's journey.
Well, thank you so much, Doctor, for joining us. Thank you for helping. And look up that information if you're interested in the How do you say it again? Evie Ring?
Evie Ring.
Evie?
Evie Ring.
Evie Ring. Way more than a mood ring. Up next, we take it to the streets on Main Street Living and discover some hands-on career options for students.